Hello, everybody, and welcome to another episode of Proactive Longevity Academy. I've got Dr. Payman Danielpour here to talk to us about aesthetics and how they work together with stem cells. Welcome, Dr. Danielpour.
Thank you for having me on. I'm very excited to chat about the exciting new frontier of stem cells and using them in aesthetic medicine.
So one of the first questions that we have from our listeners is, how do Botox and hyaluronic acid injections work to reduce the appearance of wrinkles and fine lines? And I heard you're an expert at this.
Yes, we've been doing it for quite some time. I'll tell you, we'll start with Botox and then we'll talk about hyaluronic acid. Botox is a neurotoxin. So what it does is it's a preventative treatment, whereas hyaluronic acid actually treats the lines. So Botox prevents the formation of lines by paralyzing muscle or making muscle a little bit weaker. The way lines form in the face, especially, for example, lines between the eyes or in the forehead or the crow's feet, the way they form is by muscle contraction. And what Botox does, botulinum toxin, basically creates that muscle a little bit of a paralyzing effect or numbness to the muscle. So the contraction isn't as severe, therefore the lines don't form. If you continue doing that for years and years and years, those lines won't become permanent. And it's a great way to really prevent the formation of wrinkles. However, hyaluronic acid is actually different. It actually treats the lines. So hyaluronic acid we have in our own body. It's actually a part of our structure in our face, in our skin. It gives that skin nice turgor and it gives it that supple feeling. So as we get older, we lose hyaluronic acid. We lose elastin and collagen every year, a little percentage, about 1% a year. So for example, deep lines here or lines anywhere in the face, you can fill them. So when you need volume, you use hyaluronic acid. When you want to prevent it, you use Botox. Most of the time we use them together.
Okay, thank you. And how does somebody know when they're ready to get Botox? Like we hear this a lot where it's like, am I ready? When should I go? What do you recommend for that?
So our recommendation to use neurotoxins or Botox, now I say neurotoxin because there's a variety of different names for them. So I normally say the earlier the better, maybe in your late 20s, maybe in your early 30s. Some people are a lot more expressive, so they need it a little bit more, whereas some people are less. And you don't want the lines to become permanent. And that's the key. So if you see some lines forming in your forehead that are becoming permanent, well, I'm not going to say it's too late, but you should have done it a little bit earlier. So somewhere in your late 20s or early 30s is a great starting point to start micro Botox, very little bits. And hyaluronic acid, unless you're getting like a lip augmentation that you can do at a younger age, I normally reserve putting filler based, hyaluronic acid based filler in an older population, starting at around 40 and up, maybe 50, 60, just to fill the lines.
Okay, thank you. And is hyaluronic acid the same as filler? Like when we hear the word filler, are there different kinds of filler?
Absolutely. So the safest and most frequently used type of filler is hyaluronic acid. And the reason it's the safest is because, number one, it's naturally occurring in your body. And number two, we can actually dissolve it. So if you don't like the way it looks, if you feel like it gave you a weird look or you think it's too full, well, you can always put in what's something called hyaluronidase and dissolve it. Some of the other fillers, unfortunately, you can't do that. And they're a bit more permanent. So in my hands, I like to use things that are incredibly safe, and hyaluronic acid is a great way to go.
Thank you. Thank you so much, Dr. Payman.
Of course.